Hello, this is a virtual pathology specimen of a mucinous cystic neoplasm of the pancreas, and this is actually the tumor, which is cystic in nature, involving the tail of the pancreas, and we can see that it is attached to the spleen. On rotating, the outer surface of the cyst is relatively smooth and the cyst is intact. There is no invasion into the spleen. And we can see that this cyst is composed of several locules. In other words, there are septa within the cyst. There is a main large locule here and several smaller locules. The locules appear to be relatively thin-walled. We don't see any obvious solid or papillary protrusions, which can sometimes be present. If there are solid or fleshy areas, they have to be carefully sampled because this may indicate that there is invasive adenocarcinoma arising in this cystic neoplasm. Usually in the intact cyst, it would contain thick, glistening mucin. Let's look at another example. Here is another example of a mucinous cystic neoplasm of the pancreas, and this time we just have the neoplasm without attached spleen. And again, we can see that there are several cyst locules. In some of the locules, we can still see this whitish, thick mucoid material. Usually, when fresh, this material is very viscous in nature. Let's learn a bit more about mucinous cystic neoplasms of the pancreas. These are relatively rare pancreatic neoplasms, and they occur in middle-aged to elderly women, almost exclusively in women, but very rarely they can arise in men. The epithelium that lines these cyst locules can have a range of dysplasia from low to high grade, and a small percentage of these tumors already have invasive carcinoma or adenocarcinoma at the time of presentation. They are usually asymptomatic and often they are incidentally discovered on abdominal imaging. There may sometimes be abdominal pain or pancreatitis, and the risk of malignancy is generally higher in cysts that are larger and have solid or fleshy areas, raised serum CA19-9, which is a tumor marker of pancreatic adenocarcinoma, and also higher risk in male patients. Grossly, these tumors usually arise in the body or tail of the pancreas, as we saw earlier in the first case. And also here, we can see that this is the tumor and we have the spleen. They appear as porci or multiloculated cysts, as we have seen, and they are generally not connected to the pancreatic ductal system. There is a similar cystic neoplasm that also contains thick mucin and potentially fleshy areas as well, but this is connected to the pancreatic ductal system, and this is known as the intraductal papillary mucinous neoplasm, or IPMN. And IPMNs are different and much more common than mucinous cystic neoplasms. So as we saw earlier, the locules can contain thick mucin, and there may sometimes be protruding solid or papillary areas or more fleshy areas in the cyst walls, and these have to be sampled very carefully to look for adenocarcinoma. Microscopically, and there will be a separate video describing the microscopic features, the lining epithelium is columnar and mucinous, and there is a range of atypia which can be low grade or high grade, or we can have both low and high grade atypia in different proportions within the same tumor. And as mentioned, occasionally there can be invasive adenocarcinoma, so sampling, especially of solid areas, is very important. The characteristic feature of this tumor is that the stroma beneath the epithelium often has this very cellular spindled appearance, and this closely resembles normal ovarian stroma. This ovarian type stroma is not seen in IPMNs. Calcifications may also be present. Hence, in summary, this is a mucinous cystic neoplasm of the pancreas, which often arises in the body or the tail. As we can see here, it is arising in the tail with the attached spleen. This tumor is often multilocular, and the locules contain thick, viscous mucin, and there may be solid or papillary areas that is not seen in the current specimen. This virtual pathology specimen is taken from Pathweb, our free online pathology resource. You can also view the labels of this specimen here, and if you scroll down, there will be more information as well, including gross and microscopic pictures. Registration is free and the link is in the video description. Thank you.